Good afternoon. My name is Yvette Noel. I am a certified professional compliance officer. I am the education director for KMC University. I'm so glad that you could join me today. We're going to be talking a little bit about Medicare, everybody's favorite topic. But as their education director, I have the opportunity to sit in on every new client that comes into KMC University. One, to find out how we can better serve you, and two, to find out any areas of risk in the practice. Most time I hear something that has to do with Medicare in those, and we always have that opportunity to help you get that cleaned up right away. And some of what I'm going to be discussing today is something new that we have seen. Well, not really new, it's been around for a while, but a lot of it's taken a resurgence, and it's concerning to us as a compliance company. I came to KMC University back in 2016. While serving here, I've served in the capacity of membership advisor and then as the senior membership advisor, and then moved into this job role of being the education director. And it is a great honor. I really do appreciate ChiroSecure for inviting us to be with you today. We'll look forward to spending some installments with you. And I'm ready to get started if you are. So let's go ahead and go on over to those slides together. While we go to the slides today, you're going to notice that we will be talking about to be in or not to be in with Medicare, taking a little bit Shakespeare on us today, but definitely want to talk about that very topic. Have a couple other things that we have on the agenda. We're going to discover why it is mandatory for a chiropractor to be enrolled with Medicare if you're going to touch a Medicare patient. Everybody's kind of in shock. Don't worry. I talked to a lot of people that are in shock that just thought they could get by. Well, what about if I do this? Or what if I do that? What about if you do? Then we're going to recognize the different types of Medicare coverage that are available for your beneficiaries to choose from and how you may want to react. We'll just do a little bit high overview of that. Talk a little bit about qualified Medicare beneficiaries. When we're talking about enrolling, we've got to also think about even those types of Medicare beneficiaries. And then finally, we're going to speak just a little bit about some hidden dangers with Box 24J. It's on that CMS 1500 form, and it all really does tie together here. So let's go ahead and just dive right in. We want to make sure that anytime we say something at KMC University, you know that we've got something to back it up. And a lot of people say, but I was told this, but I was told that. And we'll say, you know what? We're not just saying it, we're actually giving you the reference in documentation and regulations, guidance, statutes, and such. So we can see here that you must be enrolled to touch a Medicare patient. When we look at that bullet point, it says the opt out law does not define a physician to include chiropractors. Therefore, they may not opt out of Medicare and provide services under private contract. Don't feel bad and don't feel left out. They also do this to physical therapists and occupational therapists that are in independent practice. And you can see there it gives that explanation. But here it's quite plain. This is why we are asking for some equality for us as a group of physicians so that we can opt out. In my opinion, you get a lower error rate because a lot of people would just opt out. They don't want to deal with all that headache of documenting this way or documenting that way or doing it this way or getting the modifiers right. Everybody wants to get it just right. And sometimes it seems like it would be easier to not deal with Medicare. But unfortunately, if you're going to touch a Medicare patient, it now is the reality of your practice. So you say, okay, Yvette, you've just shocked me. I didn't realize that. I'd always heard I could just kind of stay out. I don't have to be in. And please tell me what I have to do today. Great news is KMC University can help you with it. But here's some starting points. Of course, these are just some high level things. You'll want to establish your business with the IRS. I may have someone new that's just graduating from college or getting ready to. Congratulations to you as you start your new practice. But you got to establish your business with the IRS as a starting point to dealing with any insurance and just having a business, period. Next would be you're going to apply for a type 1 MPI, meaning you as an individual need to have that HIPAA number that allows you to talk between your practice and the clearinghouse and the payer. All that just gets all wrapped up in that MPI. It's that nice way to identify you without having to throw your social out there all the time. Next down, we'll determine, Are you going to be par or non-par? There really is a very fine line in the differences between par and non-par, and it's really about the money. You're still going to have to bill, you're still going to have to document, modify, and everything same. The only difference is as a non-par provider, you can say, I'm going to accept assignment on these people, or I'm never going to accept assignment. You still have a fee that you're limited to. You're still having to document, submit, use the ABN forms correctly. Everything's the same. So when it comes down to being par or non-par, it is all about payment. It is so confusing, those two terms, because with those two terms, if we're talking about Blue Cross and Blue Shield, it's simply saying I'm in or I'm out. With Medicare, it's I'm enrolled, I'm not enrolled, and if I'm enrolled, it's par or non-par. So that is a confusing term to learn also. The next would be apply for credentialing. Now, when we go to apply for credentialing with Medicare, the tax status will determine had we needed a type 2 MPI in addition to the type 1. If our business is structurally set up as some type may be, we can get by with just having a type 1, and we may only have to credential as a individual provider. But in most situations, and especially if you're going to be adding any future DCs to your practice or any others that could enroll with Medicare, you're going to set up as a group. And there you will have to have the type 2 MPI, then you'll have to enroll each provider. This is where I really thought this was great to bring to this topic today, is because we're noticing a trend at KMC University. It was probably about 2 to 3 months ago, 8 out of 9 calls. It was just all in one clump for some reason. We were getting a lot of practices that had heard that only Dr. A needed to be enrolled with Medicare. And then Dr. B, C, and D could ride on his skirt tail. That's why our Box 24J is going to come in later in this conversation. That is wrong. If this doctor is going to touch, he has to be enrolled. If B, C, D, E, and F are going to touch, they have to individually be enrolled. And what will happen when you do their enrollment, they will go in with their type 1 and come up under your type 2, your tax ID with Medicare as part of a reassignment. They will then, and you will wait for approval from Medicare before seeing any Medicare patients. At that time, you'll be given a PTAN. Don't try to call Medicare without it. That's just going to be my plus of the day. Don't call Medicare without a PTAN. You don't get very far. And when you apply to become a provider with Medicare, generally it's going to take you about 90 to 120 days. Start training to learn how to deal with Medicare. Just to turn on the switch and just start doing it the way you've been doing it, you're going to get denial after denial after denial, because there's modifiers, conditional modifiers. You have situations where things are excluded. You have to use those particular modifiers. Start training now. Yvette, I didn't know this. I've been doing it wrong. Guess what? Start doing it right now. Stop seeing those Medicare patients, get enrolled, get trained, and go forward. These are the people who fill up your schedule from 9:30 to 11:30 every day. Now, there's an art to it. Once you are enrolled, you have to stay active. So I thought we'd have a little bit of John Travolta singing to us here, staying alive, stay alive. And Medicare gives us a couple ways and a couple things we have to do to stay alive. Some practices may be more wellness based. Maybe you never provide a service that Medicare considers to be covered, which is the spinal CMT. In those situations, you've got to bill Medicare at least one time a year. Stick your hand up out of the dirt and say, hey, Medicare, I'm still alive. Use the appropriate modifiers. Do everything you're supposed to do when submitting a claim to Medicare, and just let them know you're still there. They're a little slow to the punch sometimes, and they don't always throw you out at 12 months, but their rule says right here, you can see in number 1, that they can throw you out after 12 consecutive months of not billing Medicare. Big risk, and they will deactivate your account. There's one other way that this can happen, and we're finding it about every 5 years, they're going to ask you to revalidate. And they're trying to sync up your practice and your individual at the same time. So you're not doing your practice here and individual off here 2.5 years later, but they're trying to get those synced. But it's always important to be paying attention. They generally will send you a notification, check your email. The excuse of I didn't get it does not work. They will kick you out. And again, you will have a deactivated account. And we know you've got to be actively enrolled with active billing privileges to see a Medicare patient, and without it, you can't see them. Now that we're enrolled, we've stayed active, we're going to talk about a little bit of the differences of the different types of Medicare payers. So do you know the difference? Medicare, Medicare Advantage, QMB, oh my, we're going to take a little bit of a deeper dive. When we talk about the types of Medicare coverage, we're going to focus, because we just have a little bit of short time here together, on Part B and Part C. We can see here, though, that Part A is going to be hospital and Part D is going to be more of that Medicare prescription drug plan. Part B is where we live as chiropractors. If there's physical therapists listening in, your businesses, your little doctor's offices here and there, we're going to fall under that Part B. Part C is the Medicare Advantage plan, where the patient elects to go get something else, or maybe they had a Medicare plan, and like here in West Virginia where I live, they took the PEIA, which is the public employees, and pushed that together, and that became a Part C that just kind of merged. It's the most beautiful product I've ever seen. They have the best coverage I've ever been witness of to date. They actually have some habilitative coverage. Part B is optional. So just because they have that red, white, and blue card, you do need to be checking, but is usually their primary coverage, not always. And I'll take just a quick second in a moment to talk about that. This is the new Medicare beneficiary card. You should have already updated all of your Medicare IDs in your software to be billing to Medicare with this new MBI, Medicare Beneficiary Identifier. You can see the structure has got the name. One thing, when we notice denials coming in here at KMC University, we just don't automatically go down to box 14 and below. Sometimes we have to look at box 14 and above, 13 and above, and see that the name simply isn't how it is on the card. We have to make sure that we have that name precisely as it is seen, and that everything matches as you see it here on this Medicare card. Making sure to use that new number. They were slow to the punch where they were using the Social Security number and alpha character, but if those are still in your system, you've been getting denials. It doesn't matter when the date of service was at this point. Now you are required to be using the NBI number for any claim, any date of service that's being submitted after January 1st of 2020. And do keep in mind, Medicare has the 1-year timely filing rule of 1 year from the date of service. Medicare also has an option with some supplement carriers and some secondary to do a crosswalk. I will walk this across the street over to Blue Cross and Blue Shield Federal for this patient, or I'll walk this over to Mutual of Omaha as a supplement. But the patient has to request that. It doesn't automatically set up. It is something that the patient has to request. And we can see that often this is done through the supplemental carrier or through the secondary. And they will then send information to Medicare to get this set up to where you'll see on the Medicare EOB, it'll say claim sent to, and then WVPIA or WVBCBS. That's what it'll say. You'll know that it's automatically being sent for you. If you don't notice that, if you're in network, you're going to have to send on over, pull that patient in and say, you know what, not everybody may submit secondary claims. You may want to get this set up. I've had to do that before, and it was a game changer actually for one family. There are different types of supplements. So I call supplements the monkey see, the monkey do. If Medicare thinks about it, supplement will think about it. Oh, you thought about this? I thought about that. Did you think about that? No. Well, I'm not thinking about that. That's a supplement. It just kind of rides along and considers sometimes the deductible and sometimes the coinsurance. Maybe it's a copay. There's a lot of different structures. You can see here, you've seen people have a plan F, or you've seen people have a plan N. There's a lot of different things that go into that. But do know those are supplements, and supplements do not pick up your exams, your x-rays, your PT, your nutrition services, where we may find that a true secondary, which is typically based off of an old group health plan, maybe a retirement benefit, that may pick those up. Again, another good product was traditional Medicare, Federal Blue Cross and Blue Shield. It went very well together. Patients tended not to have much out-of-pocket expense. But the secondary, the true secondary, will consider oftentimes benefits outside of just that spinal CMT service. Now, I do want to caution you on something. With the ABN form, the patient says, I want you in option one to bill Medicare. Well, they've got a crossover. And with Medicare, you change that AT to a GA, but the secondary doesn't understand that AT-GA language and they pay the maintenance service. If you verified that secondary and they said they don't have habilitative coverage or maintenance coverage, you need to contact them when you've received a payment in error. They just don't know. They may speak the S8990 that we can't use with Medicare. That may be their language, but always keep that in the back of your mind. So Medicare Advantage is that other side of the story. The patient decided they wanted to use something else. They wanted to clump everything in one thing. Their A, their B, their D, all that's in one. They can elect what they want to do with that. And we're going to take a quick peek. This is known as Medicare Advantage, Medicare Replacement, and it redirects benefits from traditional Medicare over to that private payer. Now, I will tell you one that kind of blew my mind when it hit, and I said, I know, right? AARP, what did they do? It used to be AARP, oh, that's a supplement. And then all of a sudden, AARP comes up with AARP Complete. And you're like, what just happened here? They just got in on this Medicare Advantage. This is why it's so important that you verify benefits so that you know, one, Medicare, are you really the payer? If you're getting a denial on your EOBs and it's talking about a managed contract, it's likely the patient gave you their Medicare, traditional Medicare card and didn't give you the replacement. That's typically why you see that denial. But I know, right, they have some tricky ones out there, and I had to put the AARP Complete on there because that was the one when it first came out a few years ago. It kind of blew my mind. I'm like, well, wait a minute. You just only did supplement. Be cautious. Know what you're dealing with. The Part C plans, you don't necessarily have to be enrolled with those patients' policies. If you're not in with Humana, guess what? They're a cash patient. If you're not in with AARP Complete, they're a cash patient. Have them pay your cash rate. Let them join Chiro Health USA. Whatever type of discounting you do that's within federal guidelines, let them do that. Give them a super bill and send them on their merry way. There's no requirement to be enrolled with the supplement with the replacement plan to provide a service to those beneficiaries with that coverage. However, there are times when you may decide to submit on behalf of that beneficiary, and when you do so, be aware Medicare Advantage plans have a process that's called deeming. The deeming can, when they have specific stipulations, as you can read here on my screen, it says you must follow that fee-for-service plan's terms and conditions. If you send it, you expected to know it, they'll deem you, and bing, 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 now you're over here and having to take a contractual obligation write-off and having to play with their dog and pony show because you submitted. That's why we always recommend just use them as cash patients and let them self-submit. Always be aware of the deeming process. If you call to verify a benefit, you can always ask, do you have a deeming process? And make sure that you are not signing up for something that you didn't want to be a part of, because then it's not conditional per this patient or that patient. I'm just going to submit for this one and not that one. You're deemed in, you're going to submit for all. Medicare secondary compliance, when we're thinking about that, there's many circumstances where Medicare is going to be your secondary payer. Too much to go into today. Medicare gives some great guidance. KMC University has great guidance on this. Actually, this was a lesson I helped Kathy with a couple years ago, and trying to figure out what will Medicare pay if they're the secondary. There's an art and some math that needs done on that, and we go further into that in our membership services. But under certain circumstances, I was helping someone yesterday, just like I do. They were new to KMC University, and the patient had PI and Medicare. PI's first, Medicare second. There's a lot of rules, and Medicare can make a conditional payment. Way too much to get into. But again, this is why you have to do verification so that you know who is primary and who's secondary. And if you're one of the lucky ones, you'll get in one of those arguments. You'll be the A, B, the C your way out person that gets to watch those two fight with each other, who's primary. But It's not happening very often, but always make sure that you know who to submit to first to not delay payment. Now, on to the QMB. Promise to cover it a little bit. This is going to be just kind of a high level, not dig deep. That's what we do here at KMC. But these are people who are dually eligible for Medicare and Medicaid. They have demonstrated a financial need, and their thresholds for participation in these programs have been met. They may meet it this month. They may not meet it next month. They could meet it for 3 months and be off for 3 months. Something may change with their finances that takes them out of that level of poverty and throws them just back up right outside of it to where they only have traditional Medicare. But it can happen on and off and on and off. So just to verify their insurance one time at the beginning of the year doesn't suffice when there is Q and B consideration. So the term that's used in between there is a lot called cost sharing. Medicare beneficiaries that are a Q and B have cost sharing oftentimes for their premiums, their deductibles, and their co-insurance. And we can see that in 2017, 7.7 million people, more than 1 out of 8 people with Medicare were in a Q and B. And I will tell you that Medicare was very lax on giving a lot of guidance on this and even following their own rule, it seemed, for a while. And it was kind of loose in how we got to figure out if somebody was a Q and B. But there are some stiff stipulations. If you do not honor the Q and B being in that practice, and if you're charging them on the spinal CMT services, that is a big no-no. We'll talk a little bit more about what you can, but I do want you to know that coverage can vary by state. Now, states are supposed to be setting up a way that some of them will set up a way for you to get enrolled, and we'll talk about that in a minute. But you can see it's called the Medicare Savings Program. You'll have the QMB, which has the Part A, Part B premiums, deductibles, and copayments, coinsurance. And then it kind of starts sliding down from there. It's a tier. It's a tiered step program until you get up here to where you're all the way at the federal poverty guideline. But some people may get help with the Part A, a Part B premium, Part A and B, and then we get all the way up to where we're the actual Q and B, and we cannot charge them on the spinal CMT services that are medically necessary. Next month, I'm going to be talking about the ABN. There's some specific things that came out. We actually have some questions out to Medicare. That's just how we do it at KMC University, that we want clarity on before we let it loose to all of you and give guidance. But important reminders. All original Medicare and Medicare Advantage providers and suppliers, not only those that accept Medicaid, must not charge individuals enrolled in the QMB program for Medicare cost sharing. Must not. There are stiff penalties to pay. Individuals enrolled in the QMB program keep their protection from billing and being charged even when they cross state lines. And 3, I don't care what that QMB tells you. Note that individuals enrolled in QMB cannot elect to pay Medicare deductibles, coinsurance, and copays, but they could, under certain circumstances, have a Medicare copay. How are you going to know all this? It all goes back to that root concept of that patient experience in your office, and that is called verification. Verify, verify, and verify again. Ways to promote it. They came up with some stuff that I found right on their website that says how to help promote it. Establish processes to routinely verify, 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 verify Medicare patients for QMB. Now, one of the easiest ways to do this is through the HIPAA eligibility transaction system called HETS. Get set up on it if you're not on it. They have some of the best information out there on letting you know if someone is a QMB or not. Check it frequently. Determine your billing processes. Could be different with Medicaid, Medicare Advantage plans. Get enrolled with Medicaid, but I don't want to treat Medicaid patients. You know that some states have it set up. I can't say if it's yours. I told you they vary state from state, but some states have a program set up where you can enroll just to get the Q and B stuff taken care of, and it doesn't open the door to make you have to do all Medicaid. So do check with your state. I found several states while I was investigating this that have this kind of half in just to get that adjudication for Medicare. And one thing that I found was even if your state does not have coverage, Medicaid coverage for chiropractic, the QMB actually says that it has to pick it up. It's right here. It says services not covered. As noted earlier in this informational bulletin, a Medicaid agency's obligation to adjudicate and reimburse providers for QMB cost sharing exists even if the service or item is not covered by Medicaid, irrespective of whether the provider type is recognized by the state plan or whether or not the QMB is eligible. Read it for yourself. It's out there to see. So, can you bill for your statutorily excluded services to a Medicare beneficiary that has QMB? You better, because you can't offer service for free. They might qualify for your financial hardship. Maybe they chose your discount medical plan. But yes, 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 you must charge them for the other services to not be caught as having an inducement trying to get somebody to come to your practice. You're just trying to be nice, but it can all be misconstrued. That's why you get it spot on, get it the way it needs to be, write a policy, everybody gets trained, and we just move forward. So that brings me to my final thing that I want to cover with you today, and that is going to be the hidden dangers of the Box 24J. So when we're talking about the hidden dangers of Box 24J, that was exactly what I was mentioning back in the very beginning, and that is every doctor in the practice has to be enrolled with Medicare. That means if you touch the patient, Dr. A, your MPI individual goes in Box 24J. And if Dr. F touched them, it's his MPI that goes in 24J. Of course, 32 and 33 is your practice. That's set up. You'll get your payment. That 24J is certifying I am the one who touched that patient to date. It was me. It wasn't an imposter. It wasn't somebody else pretending to be me using their number just so we can get paid and they don't have to enroll. Who wants to go through that hassle? You better go through the hassle because they say you have to be enrolled to touch them. Box 24J. The reason I'm stressing this today is because this is something we're seeing right and left. I'm seeing practices that have bought somebody else's practice not be set up with Medicare right now, using someone else's tax ID, using someone else's MPI just to get payment. You can't do that. You have to be enrolled. And if you touch them, you're Box 24J. Locum tenens, that's your only exception. Fee for time service compensation, there's rules there. We're not covering that today, but make sure you're covering it. Box 24J, you can see it right there on the screen. That's who touched the patient. If everyone is enrolled, but you keep using the same doctor in Box 24J, guess what you just did? Think back earlier in my conversation. You just deactivated B, C, D, and F doctor. So 24J is who touched that patient today. Always make sure that you have that spot on. Now, like I told you, a lot of stuff just came out about that new ABM form. You have until August 31st to implement the new one. We are asking for clarity from Medicare. They did give additional clarity in their ABM guidance this time around. That was very nice to see, but there's still some questions to be asked, and we have those questions out. We've already had one of them answered, and before I come to you and give you more instruction on the ABN form, we want them all answered because KMC University absolutely insists on accuracy. So do you just wonder about your practice? Did I spark a chord in you today to just make sure you're dotting your I's and crossing your T's? And maybe you're looking at denials and maybe you don't understand why this or that is happening with Medicare or anything else in your practice. We offer, as part of today, for those attending through ChiroSecure, to do one of our discovery consultations that are typically $79 for just $49. And with this $49 investment, you'll speak probably to me as your specialist or to one of our specialists that will help to get to the bottom of what's going on, kind of like taking the history, an exam, and an intake, and we'll set a personalized treatment plan for you. Do you need to be in some acute care with a coach, or do you need to just be in here under some supportive care to where you are able to ask quick questions? I ask that you just reach out to KMC University. It's at www.kmcuniversity.com, or give us a call at 855 832-6562. Mention that you saw us here on the ChiroSecure webinar and that you're signing up for your discovery consultation for just $49. Again, any questions you may have, you may reach out to info@kmcuniversity.com or call 855-832-6562. Any questions that you have, I definitely would welcome them, would love to speak to you. And I want you to make sure that next week that you'll join up with us for Dr. Sherry McAllister, and she'll be speaking from the Foundation for Chiropractic Progress. She'll be right here with you. This was Yvette Noel, the Education Director for KMC University, also a certified professional compliance officer. Not a whole lot of us in the world, but just looking forward to seeing you again next month when I've already told you that the topic is going to be on that brand new ABN form, just to make sure we're getting it out to you just in time before that deadline. Thank you so much for joining me, and I hope you have a beautiful day.